Is it already on? Yeah. Good evening. I'm Dr. Michael Hanafin. I'm a decorated Air Force veteran, small business owner. I hold a bachelor's degree in science, a doctorate in chiropractic, and I'm currently a candidate for my doctorate in education. I oppose the extension of the order based on several factors. First and foremost, it's against the Constitution. It's an abhorrent act by our legislative body to violate that. Continuing on to the CDC website, which you guys love to quote, the goal of community mitigation on the CDC website is emphasize individual responsibility, not mandate it, emphasize it. Empower businesses, schools, and other settings to implement appropriate procedures. You need to prioritize the settings for critical infrastructure services, which you guys have had 8 months to work on, and you have come up with nothing as a plan to move forward. The emergency room doctor that spoke should have had a plan. If you don't have a plan for this, then you're going to run scared every single time and come to the conclusions that you guys have. It also says that you need to minimize the disruption to daily life to the extent possible to ensure the access to healthcare and other essential services. There is not access to healthcare. There's doctors that are doing telemedicine that should be in-person visits. As a chiropractor, I'm fortunate. All of my stuff has to be in person, and I love seeing my patients every day. But even my practice has suffered a 30% decline in patient visits because of the mandates and because of the fear-mongering that this assembly has done. My second point is the fact that the PCR test that's being done, as the previous caller admitted or spoke about, you cannot cycle this thing more than 30 times and have it be legitimate. The PCR test was never designed to diagnose a disease to let you know you're ill or that you're contagious. This is the research. Your doctors that are advising you know this. When the PCR test was designed, it was to let you know something was there. They can test for anything. It just signifies that it's there, not that you're sick. With my remaining time, I went through all 9 studies on the Department of Health's website. Your own website, okay? All 9 of them. Not a single one was definitive that masks work, because they don't. You cannot hide from a virus. It's out there. It's a May. This one used a model. You had a futuristic one on there too from 2021. That was interesting. So, children under the age of 10, not testing positive, not an issue. Schools should be open for at least them. That's my testimony. I oppose this mandate.
Thank you. I have a question for you, sir, from Ms. Allard.
Hello. Thank you for your service. Much appreciated. Can I get your name again, please?
Dr. Hanafin.
Thank you, Dr. Hanafin. So I have been taking some notes tonight, and I wanted to ask you a couple questions if you can answer. So they say there's a large number of asymptomatic carriers. There are also a large number of people that will continue to test positive after they are no longer contagious. Have you heard that before?
Yes, ma'am.
And why did you hear that?
Through the research that I did, the additional research that I did, when we look at asymptomatic carriers, the study that I reviewed was from both Italy and from Iceland. They were the largest cohort studies that have been performed to date in regards to COVID. And they demonstrated that somewhere between 46 and 87% of those tested will be asymptomatic. So, by that means, the spread of the virus is going to happen, and many, many people are not going to show signs of symptoms. The benefit of that is that they're not impacted by those symptoms. They're just positive. But the PCR test will also show positive for a coronavirus. There is a human coronavirus. That's going to show up on a positive test. That's the common cold, by the way.
So Dr. Hanafin, no matter what we do, and if people keep testing over and over and over, if they're positive, the likelihood of them not being contagious, but always positive, it's there. That's a fact.
It's
a
very
medical
high.
fact.
It's
Okay.
absolute fact.
So I'm going to ask you a couple other questions, and just a simple yes or no. Did you know that Alaska is 49th in the country for COVID deaths per million? It's pretty good.
Yeah.
Also, we're 29th for the total case per million, which means we're either the death rate is low because of the demographics, that we're younger and we're more fit, or we have a less virulent strand. Can you explain that, what that means about the strand, so I can understand it a little better?
The flu virus is a great example. Some years the flu is much more virulent, and it has a lot to do actually more with stress levels of the individuals than it does about the actual strand itself. If we continue having these lockdowns and these fear-mongering and these misrepresentations of the actual science, then you weaken people's immune system. You don't allow them to exercise. We have not seen anybody from this body or from the doctors that are advising you advise on supplementation that could be beneficial, like vitamin D, vitamin C, and zinc, all been proven to help not cure it, not avoid it, but at least boost the immune system enough that you have a better chance of survival, even though it's 99.95% survivable.
And then my last question to you is, we all have our mask. Do you talk to your friends and other people that say every single time they have their mask, they absolutely wash it, or they put a new one on, or they don't touch it throughout the day and leave it on their face non-stop?
Okay, that was my biggest thing in the very beginning of this, is the fact that although we'd love to think that everybody knows how to wash their hands, we have to give them instructions, but these masks are absolutely hanging in everybody's car for days. And they're picking up everything coming in and out of that car. So the chance of actually exposing a patient to something more deadly is higher by wearing masks that people cannot stand on their face and touch and cross-contaminate. And then in California, they said, take your mask down, take a bite of food, and put it back on. What do you think they're doing? They're literally cross-contaminating with that mask every single time you touch it. Now, I'm actually really impressed. Very many of you haven't touched your mask tonight. I can't stand it. You've done a great job too until now.
Thank you. Moving on, I have Ms. LaFrance.
Thank you, Mr. Chair. Thank you for coming and for testifying tonight. I'm sorry, I missed your credentials. You are a doctor
Of chiropractic.
chiropractor,
Yes, ma'am.
and then you are working on a PhD
I have it in education.
in education. Okay,
Yes, ma'am.
congratulations, thanks. I wanted to be clear, I understood what medical credentials you have. Thank you.
Thank you. Mr. Constant?
Yeah, thank you. I've been having a little hard time hearing that testimony. I'm trying to understand how much virology this speaker studied in medical school. Thank you.
I'm sorry. Could you repeat that one more time, Mr. Constant?
Oh, I heard him just fine. And he responded to my email, the first testimony that I gave, as you, Ms. LaFrance, so rudely put, my medical credentials. Just because I'm not a medical doctor does not mean that I don't have an education in, Mr. Constant, virology, immunology, histology, biology, biochemistry. These are all standard classes that I take, and I graduate with over 300 credit hours more than the average MD in this town. So don't question me on my education. It's all included, including virology.
Thank you. Again, I'm going to ask folks to not... So I'm going to go ahead and just give a final warning to you, Mrs. Hill, and to you, Mrs. Wilson. Otherwise, I'm going to ask folks to not be hooting and hollering, please, because that's not helpful to our process. Ms. Allard?
Thank you. So my last thing is that, would it surprise you to probably know that you have more medical experience than anybody else in this room tonight?
I certainly do.
Thank you. And the other last question to you is, do you know of other doctors and nurses, as I do, that have refused to come forward and testify because they're worried about losing their licenses or the backlash from their superiors?
We have had several things put out by our board for the chiropractic community that have encouraged us not to talk about vitamins, not talk about things that will boost your immune system for fear of backlash. I put out a video, I refuse to delete it. I served my country to defend your right to do dumb things.
Thank you.
Thank you. Thank you for your testimony. All right, we're gonna